Thank you very much for staying with us. My name is Vivian Dagwa, and this right here is Good Morning Kenya. Now, on Health Tuesday today, we are going to be focusing on the state of health, or rather healthcare in Nairobi, and specifically we will be narrowing it down to Pumani Maternity and Referral Hospital. And joining me for this particular conversation is Madam Evelyn Ikwi Omasaja, who is a member of the board and the chair of the finance committee of that particular board. Madam Evelyn, welcome to Good Morning Kenya. Thank you for your time.
Much. Thank you very much, Vivian. I'm happy to be here.
I want to start by asking you if you were born in Pumwani.
Thank you very much, Vivian. Yes, I was born in Pumani Maternity Hospital.
Okay.
Yes.
So you're a Pumwani baby.
I'm a Pumwani baby, yes. And we are looking for many more Pumwani babies to come and celebrate with us.
Okay, before I get into Pumwani Hospital specifically and just get to know what is happening in that facility at the moment and what has changed over the years, I want us to look at the overall healthcare in the country, or rather Nairobi specifically. What is the current healthcare state in Nairobi?
I must say that Governor Sakaja has really done a marvelous job in changing the management of health facilities within the Nairobi County. You realize that come May this year, he brought in a new board across all the facilities. So you're looking at a new board in Mama Lucy, looking at a new board in Bagathi Hospital, Mutuini, and Pumwani Maternity. And the new boards that came in brought in a total change in the style of management, where we are actually focusing on improving the welfare of the staff within the facilities. We are looking at equipping the facilities, and we are looking at basically just ensuring that services to the Mwananchi are superb. What I can say is Governor has also ensured that we have the medicines that are required, medical supplies, okay? And you realize that you'll always flag off quite a number of trucks going to the various facilities and dispensaries. Okay, so you're looking at the level 5, we're looking at the level 4, level 3, until the dispensaries that we have within the estates. So you'll not hear any noise in terms of we don't have medication. He has done a marvelous job. We are also working towards ensuring that staff are adequate across. They may not be at the standards of the World Health Organization, but we are saying that we are doing a fantastic job to ensure that we are properly staffed across Nairobi County. Yes.
There's something you mentioned on the managerial positions being held by in most of these hospitals, that is the board, and I've realized that we don't have doctors specifically taking the managerial positions like the CEO, like we're not having doctors. Is that really strategic? What
Governor did when he came in is to bring in chief executive officers within our facilities. And that was strategic in a way to ensure that the doctors, the medical superintendents that were there previously were released to go and actually handle medical issues within the facility, that they are treating the patients, that they are within our theaters, that they are across. Okay, they're actually with the patients as opposed to being in meetings, you know, and that is why he said, let us get a CEO who can now come and handle these other non-medical issues, okay? In terms of managing now the facilities properly, they can actually run around, but let us relieve our doctors to go and treat the patients. So that is why you'll find that across Nairobi County, we have chief executive officers in all facilities. Yes.
I get you on that. Now, maybe what are some of the factors that you would say that you can point out that are affecting healthcare?
One, of course, having adequate resources in terms of having enough money that can buy all that you need. It will affect. We don't have resources across the country, and Nairobi is no exception. But what we are doing differently is ensuring that that which we have is effectively and efficiently utilized. All right? To ensure that we are able to actually meet that which is needed by our patients. It may not be enough, but we are using it effectively and efficiently. Yes.
Yeah. Now, since devolution, you know, is here with us, how would you say devolution has impacted healthcare this far?
You know, the essence of devolution was to bring services closer to mwananchi. And for me, devolution is the best thing that ever happened to Kenya. When it comes to healthcare, we are basically saying that mwananchi also has a say in how things are run within their area. If we take an example of Pumani, we are now doing what we call Pumani Mashinani. In essence, we're saying we are bringing services closer to mwananchi so that they are part and parcel of the conversation, all right? And that is what devolution is supposed to do for the country. It is no longer decisions being done at the high level, but decisions being made at the lower level. And where we are all engaging, the community comes on board, the management teams comes on board, the professionals come on board, the political class comes on board, and we are able to have a roundtable conversation around our health. So it is actually a communal and an all-inclusive kind of conversation. And for me, that is the best that can ever happen. Because who knows where the shoe pinches? It is the patient, the mwananchi down there. And if he's able to come and talk and converse with the team that is leading the facility, then we are ready to move. Yeah. So for me, devolution is excellent, and let us actually work with the spirit of devolution, bringing services closer to the people.
So it is impacting the healthcare systems.
Yes.
Yeah, it's impacting it in a good way.
And you know, we have two levels of devolving services. We have the national devolving to the county level, and then we have the county devolving to the sub-county levels. Yeah. All right? And that is what is most important. That even as national now says counties handle your issues, all right? The counties also have the capacity to build capacities at the sub levels also, to ensure that the sub-county levels and the ward levels can also handle their issues. And that is how health is supposed to be. Because we have the level 5, then we have the level 4, and then we come down to the dispensaries. And if they're also able to manage the services at that level, then healthcare is going to work. And it is working for Nairobi County.
It is working at the moment,
yes,
as we speak.
Yes, yes, it is.
All right. What are some of the trends that you'd say we've adopted in healthcare that are working?
One, as I said initially, is management. Yeah. You know, for anything to work, you've got to have an excellent management system. And what is working so far, having come in May, is the fact that the boards have been given that independence to engage with the health management teams within the facilities. And that is working, okay? Because then the board is able to, together with the health management team, have a vision for the facility, all right? And the implementation is actually done at that level. What the county is doing is supporting these initiatives by ensuring that whatever resources that are required are actually shared across to ensure that the implementation phase of whichever project that any facility has actually happens. That is working. You'll also realize that what Governor did is he brought in, the boards were mixed up properly in that we had community representation. Then we have the religious community representation, okay? And then we have the professionals also coming on board. So that is a team that is all-inclusive. So that now the board member that is coming from the community brings the views and the concerns of the community to the facility, all right? So that now we are able to make decisions based on what is actually happening on the ground. For me, that was a marvelous thing that Governor did in ensuring that the voices of the people can actually be heard at the table where decisions are being made. And then from there now we are able to come up with programs that actually touch on their lives, and they can actually get feedback. You know, the beauty is, if you are sent to come and make a representation and you do nothing, you are going to go back to the same people and they'll ask you, what have you done? We sent you and you have not. So the board members that are actually coming from the community ensure that their concerns are actually addressed. And for me, that is superb.
Yeah.
Yeah.
Now narrowing it down to Pumani Hospital, Maternity Hospital.
Yes.
It is actually the biggest maternity hospital, not only in the country, but in sub-Saharan Africa. And every single day, 50 to 100 normal deliveries are done at Pumwani, and around 10 to 15 C-sections are done there. If we look at these numbers, is it a rise?
We can say that it's been stable. There's a time it was much higher, it came down, and now we're actually peaking once more. So I'm actually happy with those numbers. But I know that we can actually do much more within Pumwani. All right? You know that Pumwani is now 97 years old. We have 3 years to go to 100. And we are excited about it.
So the first baby who was born at Pumwani is 97 years old today.
Yes.
Wow.
And that is exciting. All right. Because you realize that if we look at Kenya, even the former president was born at Pumwani. And I know that there are so many other people in leadership positions at the higher level who are actually babies of Pumwani. You know, having been there for 97 years, it has actually given birth to many other facilities that are actually serving wananchi in Kenya. So for me, Pumwani is one of those facilities that we actually need to hold dear within in our hearts, because it is the facility that has actually given birth to so many of us, me being included. And I know that if we ask, today we ask Kenyans, how many of you are baby Pumwanis? We'll have thousands. We'll have thousands of babies coming across. So yes, our numbers are crazy. We have the 50 to 100 births daily, you can imagine. Every day we are admitting 300 mothers for delivery. And out of those 300, we have between 50 to 100. On average, we are doing around 70 every day. And we have 2 theaters in Pumwani that are running both day and night. We have a 3rd theater that we are working towards also, you know, improving and equipping to ease out the queues that we have. So yes, Pumwani, in terms of facility, it is an excellent facility, and we are actually working towards equipping every single department to ensure that we are actually able to serve our people the way they are supposed to be served.
Yeah, speaking of service, I understand that, I mean, the level of midwives, the midwives to mothers, it should be one midwife to one mother to two midwives, actually. One mother to 2 midwives. But as it is at the moment in Pumwani, we are having 1 midwife serving up to 18 mothers. Why is this shortage? Why is there a shortage? Is it that we don't have enough midwives, we're not employing enough of them, or what is happening?
You know that currently when it comes to employment, resource-wise, we have a challenge as a country, not just Pumwani, but as a country, we have a challenge in terms of resources that we require to actually employ the adequate number of nurses that we require to serve our patients. There are those, again, we are losing also a number of nurses because they are going out of the country for greener pastures, and you can't really stop anyone from seeking greener pastures outside. So we have those 2 things happening. The resources not being enough to employ as much as we need, and again, the ones that we have seeking out greener pastures out of the country. That is a challenge. We have KMTC, we have the Pumwani Midwifery School that is actually training nurses to come on board. So ours is to ensure that the recruitment, the training process is continuous, all right? So that even as we lose those who are going out of the country, we are training many more to come and fill that particular space, so that at the end of the day we have sufficient. We have spoken to the county government, and they're actually working towards recruiting more nurses for us as Pumani Hospital, so that we are able to actually reduce that gap. What we are doing as a board at the moment is to bring in nurses on locum basis, all right? So we are in the process of actually recruiting another 20, all right, to come in and reduce that particular gap that we have. So we are working towards ensuring that we try as much as possible to reduce that particular gap and increase the number of nurses that we require to actually take care of our mothers.
Yeah, so what you're doing to curb that challenge is to train more nurses?
There's the Pumani Midwifery School is training more nurses to come in and fill that particular space. Yeah. But at the same time, right now, we are actually bringing in more nurses on locum basis. Okay. All right. Okay. As the county recruits for us. Yes.
All right. Now, since the current governor took over, office, what are some of the changes that you'd say have taken place at Pumwani?
Quite a number of things have happened. We didn't have a lift for a good 70 years. All right? And when Governor came on board, he ensured that the lift that was there has been renovated. It's now working. Initially we had mothers who had to go through surgery, having to walk the stairs all the way to their wards. But now the lift is working, and it is actually easing out quite a number of things for us. Patients coming down, patients going up. Fantastic job that he has done. We also didn't have a generator, a standby generator. It was a challenge. When the moment power went out, things would go crazy for us. But now we have a standby generator that is able to serve our needs, serve the theaters, serve the entire facility. We are happy about that. Recently, we had a blood bank drive, and we actually broke ground for a section. We're actually building a whole section for a blood bank to ensure that no mother lacks blood during surgery. Okay. The other thing that governor has done is that he's given us resources towards increasing we have what we call the human milk bank. All right. For those babies whose mothers have passed away and they need the normal breast milk. So the mothers that are able to give extra milk after breastfeeding their babies, that milk goes through entire pasteurization process and is safe for sharing with other babies. So we want to increase that. Governor has given us resources towards that to ensure that we are able to take in more milk, pasteurize more milk for other babies. You know that we also have babies who come in because their mothers passed away during delivery. Those babies actually given that milk. So we are actually increasing that particular milk bank to serve more babies. We have what we call a newborn unit, NICU. We are also trying to increase the beds that are there, trying to equip it, and governor has given us resources towards that. So in terms of commitment from the governorship, it is excellent. And now ours is to ensure that that which we've been given, we are using it efficiently to serve Mwananchi.
Yeah. Now, I've heard about all that, but we cannot put a blind eye to the negative stories that we've heard of Pumwani. For the longest time, Pumani Hospital has just been in the headlines specifically for the negative stories, and the really sad stories, especially when it came to the alleged baby theft stories. Where are we with that? Where are we with that, and how are we demystifying that? And how, not just demystifying, how are we changing that? Because if it was actually happening, I said alleged though, but if it was actually happening, what are we doing to change that? You realize that those stories, I think, could have been there 2-3 years back, or even, quite some time back. But we, as you know, that is 2 years back.
That is more than, is it 2-3 years? Now, since we came in, we have not had any of those incidents of alleged baby theft. What happens during delivery? The moment a mother delivers her baby, the baby is given a tag with the name of the mother, the birth weight of the baby, and everything. It is put on the leg of the baby, so that now we are able to tell this baby belongs to which mother at the point of delivery. Because when that process is going on, we have quite a number of staff that are there. We have several nurses, we have the doctor, we have the midwives. They all surround the mother. So at the moment the baby is delivered, there is a nurse who's given that baby particularly to take care, and the baby doesn't leave the mother before it is tagged. And then the baby is taken for cleaning and all. If the baby is normal, it is given directly to the mother immediately. So there's no way the baby is going to be kept elsewhere for anything to happen, any fishy thing to happen. So the mother is in the view of her baby, and the baby is immediately named. For the babies that have need extra medical attention, they are taken to NICU, okay, the newborn unit, and they are taken there after they've already been named. And you know that your baby is in a particular baby cot. So those issues of incidents of babies being soaked or anything like that have completely gone, completely finished. We have an excellent security team that works with us. You'll meet them at the gate. You'll meet them even in the wards, and they are there to ensure that no one leaves the facility with anyone's baby. You only live with your baby. So in terms of security, we are doing an excellent job to ensure that you are safe with your baby. That even if you have to sleep a bit, you know that your baby is safe, and no one is going to change your baby or anything like that.
Yeah.
Yeah.
And well, I still want to stick on that story a bit, if you would allow me. It's not just in Pumwani that we've had such stories. You know, just the other day, I think last month, probably 3 weeks ago, we had a story where a lady was complaining that, you know, she gave birth to twins, and then she was given one baby, and then she was told later on that the other baby died, but, you know, she saw the baby wasn't dead. Just these stories, you know, they're really horrifying and they're really sad. So is there anything that is being done to, you know, the rogue maybe doctors who take part in such, or the rogue staff members who take part in such? Is there anything that is really being done? Because from that story, following up on it, I don't think any arrests were made.
I must say that I will not have a complete picture of that particular incident, but what is happening across all Nairobi facilities is, number one, security has been enhanced. All right? And our staff have been completely sensitized on the care that they must give to the patients, the mothers and the children, to ensure that our work is to give satisfaction to the parent, to the mother, that when you come to deliver within our facilities in Nairobi County, you are sure that you'll go home with your baby. And if anything happens to your baby, you'll be given a clear view of what actually happened or what transpired. So for me, I would always ask the general public, first and foremost, to seek a good explanation from the facility in which you are being served, to completely understand what has happened, so that you are satisfied with the position that you've been given. And our doctors, our nurses, and our caregivers have all been sensitized that you need to give complete information to the patients, and you need to ensure that they are properly taken care of, and the babies are properly taken care of. So I may not be able to comment exactly on that particular incident. The facility will definitely have a complete and a better position to actually give more info. But what we know is there is complete turnaround, okay, in terms of how we care for our mothers and how we care for our babies. Yes.
Okay. As you work on transforming and revamping Pumwani as a whole, are you looking into changing the name, maybe? Is that something that you're looking into?
No, for now, no. We like the name Pumwani. What it means actually is
it's the Swahili word.
It's a Swahili word ya kupumua. You've breathed, you know, after delivery, you know, as a woman, as a mother, that process can be something before the baby comes. And the moment the baby comes, the pain completely goes, and you can relax.
A sigh of relief.
It's a sigh of relief. The baby is out, you're happy, you know. So we really wouldn't want to change that name. It has meaning. It actually resonates with the mother, and we would want it to remain that way.
Also, you're not going to change it?
No,
because
no,
I thought that, we know from it having gotten very, you know, bad publicity in the past, maybe you'd want to change the name, but you've told us you're not working on changing it.
It has meaning in terms of the delivery process, so we'd want it to remain. The experience that people are going to have of Pumwani going forward, you would even want to be associated with it. So changing the name would completely lose its, it's 97 years that it's been there. So what we want to do is give that positive experience going forward. And the team that is on board now is actually out to ensure that you have that positive and nice energy, and you'd love to be associated with this. We have quite a bit of things that are coming up that I think we'll share as we continue with the conversation.
Yes, actually, speaking of that, let's talk about the campaign, Pumwani Mashinani. What is it all about? It just happened, I think, on the 10th?
On Friday, yes.
Yes, the 10th. Just tell me about that campaign.
What we did, one of the mandates that Governor gave us is to ensure that we are engaging with the community. And for us, we say that most of the time we wait for the mothers to come to us. And because of what you're saying, the bad publicity that has been there, people really do not want to come. But now we said we want to unbundle Pumani. We want people to understand who is Pumani and what do we do at Pumani. And for that reason, we said, let us go to the public. Let us go to the mashinani. Let's go to the community. Let us explain to the community what we do. Besides delivering, helping mothers deliver babies, we have much more in terms of services. We have the antenatal care. The moment you conceive, we always say, come and start your medical checkups early. What does that do? It allows the medical practitioners to be able to walk with you through your maternity journey. If there are any conditions, any complications that are likely to arise, we are able to see it in advance and help the mother. So the antenatal care is available at Pumani Maternity Hospital. So we are asking people, come early so that we are able to walk that journey with you. If they come early, then we are able to mitigate quite a number of issues that can arise. You know that pregnancy can have, pressure can always arise in pregnancy. We have sugar issues that can arise in pregnancy. So coming actually helps alleviate that. We have had 7 cases of maternal deaths this particular year. And when we analyzed those cases, it was actually as a result of delayed coming to the hospital. You delay wherever you are. Oh, you want to see whether it can work. You only want to come last minute. That is what actually gave rise to a number of the maternal deaths we've been having. And we're telling them, if you come for your antenatal early enough, you're able to tell, and you're able to come to the facility early for delivery. And you don't wait until things really become hot. Then that's the time you want to come. All right. So we want to make people understand, why are we asking you to come? Come mapema. You be taken care of early as possible. So we have antenatal. Then we have the delivery. Delivery can either be normal, it can be CS. We have both. We have the 2 theaters that are working now. We are working on a 3rd theater. All right? So there is much more happening within Pumwani. The area that we are working on quickly, immediately, and especially this quarter, is to equip our delivery room. We are bringing in delivery beds so that our nurses also have an easy way of working. We can adjust the bed upward, we can adjust the bed downwards to be able to serve the mamas. Previously, it was not there. Our mothers were actually delivering on normal beds. And the moment we went in and we saw, hey, this one, no. We are bringing in delivery beds. We're bringing in for this particular quarter, and we'll keep adding as time passes by. All right? Now, within the delivery area, of course, now we are telling our mothers, now we are increasing our midwives. So that thing of one midwife serving, we are actually bringing in 20 more who will be working day and night, okay, helping our mothers. So that notion that was out there that uko utapanga line, yes, kuna line, lakini it will not be as long as it was. It is going to be shorter now. You can imagine delivering 70 mothers in a day. Definitely, the traffic is heavy, but the nurses are also are going to be more, all right? When you go to the newborn unit, all right, we are also working towards increasing the number of baby cots, increasing the equipment, you know, ensuring that now we can take care of the most delicate babies. We had a baby that was born with 600 grams, you can imagine. And they have been within our newborn unit, and they left the facility at 1.8. And that is something to celebrate. And that is what we are saying, that now come with the babies. Don't sit at home with a baby who is unwell. And you're wondering, what do I do? Bring that baby to Pumwani. Let us help you. Let us see how we can ensure that that baby is well taken care of. Now, there are those babies who are born with certain conditions, club foot and all. We have a physiotherapy unit within the facility. So you bring that baby for rehabilitation. Don't sit with the baby at home. All right? So we are telling our mothers, come, let us engage. Let us help you. So that you have a safe delivery process and post-delivery process. So we are looking at both pre-delivery, delivery, and post-delivery. How can we ensure that you are comfortable and you're getting the best services that you can get from our facility?
Yeah. And I would have to commend you as the Pumani board in general on the Pumani Mashinani and the governor himself, because it is such a good initiative. You are offering free services,
yes,
you know, and so many of those services were being offered for free during this particular event that was happening. So it's a really good thing. It's a really good thing that you're doing.
If I may add, we did a bit of screening also. We did a cervical cancer screening. We did the breast cancer screening. You know, and then we just sensitized people. We had a whole nutrition conversation happening. And most important, when we did the Mashinani project, was to sensitize the men. They are a critical component when it comes to the maternal health of our mothers. Okay? Why is that very important? It is a man in most homes that makes a decision to pay for NHIF. We need our mothers on NHIF, because once they have that, the burden of the financial burden is actually reduced completely. So we wanted to engage and tell our men that come on board. Come and see what happens to your wife when she comes for delivery. Let us walk you through that journey, all right? So that you are part and parcel of this conversation. You also realize that the man is very critical when it comes to him bringing the wife to hospital. So we wanted that conversation happening at the community level, so the men understand that this is not a woman's affair. It is a conversation between both the husband and the wife. So the man is very important to us. And that is why we will continue engaging with the community. We have the community health providers, the CHPs. We are actually working with them within Pumwani to ensure that as they go to their nyumba kumis, and they are able to identify mothers who are pregnant, that they are able to tell them, you need to start going for your clinic as early as possible. Now they're helping us because they're able to also talk to the men within those particular homes. So for us, that partnership with the CHPs is critical. And that is why we want to continuously engage with them. So Pumwani Mashinani started on Friday 10th November, and it will continue.
So it's something that will be happening.
Yes.
Maybe is it
every quarter we will be every quarter we will be having an outreach, different parts of the county, because our catchment area goes all the way to Kayole, Umoja, you know, Huruma area, Dandora, then you come to the Pumwani area, Kamkunji, Isili. That entire area is our catchment area. And we will be moving from one catchment area to another, sensitizing the community that this facility is available for you. You don't only need to come when it is critical, you can come even much earlier, and we're able to serve you. Yes.
There's also, you are also sensitizing the community on the HPV vaccine that is to be administered to young girls from the ages of 9 to around 15, 12 years old. How did that go? Because I feel like this is a conversation that many parents really are not open to. Maybe they think, you know, they're not really sure about this particular vaccine, yet it is quite an important vaccine. We've had doctors here talking about it, and from what they say and from what is in the books, it's really important because it can help in eradicating cervical cancer completely. So how was that, since you were offering that service as well for free? Did you have mothers who brought their young girls?
Yes, what we did actually before the Mashinani Day, what we did is we had a community, the CHPs, and then we had a community person that kept on going around and informing people that we are having this vaccine, come and informing them and educating them. We also had quite a bit of that happening within our radio stations, sensitizing the community that bring your babies for this particular. It was good that we actually had quite a number of children that came in for the vaccine. Of course, most people are a bit skeptical about it, but that continuous conversation is what is helping us as Pumwani. And that is why for us, working with the CHPs is much more, it's more effective, all right? We did it on the day, but the CHPs are really helping us. Because we realize that the cervical cancer vaccine, the HPV vaccine, is a bit, not everybody understands it. So you need to have a round table conversation where you continuously educate and continuously inform and let them know that this is important for you. On a third visit or fourth visit, that's the time they will come for the vaccine. So this conversation for us is continuous. We began with the CHPs. We are continuing with the community sensitization. When they came, we gave the few that came in. We were happy that they're actually coming, but it is going to be a continuous conversation. Because you realize that cervical cancer affects the woman. And for us, your mama is a very important person to us. For us to continue keeping our population growing, then we must take care of the sexual health of our mother, we must take care of the uterus, we must take care of the cervix, and if there's something that's going to threaten that, we are going to work on it. So for us, that is going to be a continuous conversation. We've started it and we'll continue with it.
Okay.
Yes.
You are revamping the Pumani Nyayo wards. You want to set up the first government-owned children's hospital in Nairobi, and it will actually be the first one in Kenya, if I'm not wrong. Tell me about that.
The late President Daniel Arap Moi had actually started the Nyayo wards. It stalled along the way. Nothing has happened until now. The county government, through the leadership of Governor Sakaja, has actually been working hard to ensure that that facility comes back, comes to Pumwani. There's a time that it had actually been taken up by the national government, but that conversation has now brought it back to the county government, and it's going to be under Pumwani Maternity Hospital. Now, what we want to do is separate now the care, that once the babies are born, they can now be taken care of at now what we are going to call the Pumwani Child Hospital. It is going to be the first public hospital within Kenya and Nairobi County that will be exclusively serving our babies and our children. We have already the private facilities that exist that are serving children, but within the public sector, that will be the first public facility that will be exclusively for children. And that is what we want to do, so that we can enhance the pediatric care that we have for our children. And we can have doctors that have specialized, in taking care of the children. Because it is going to be complete. It will have a theater for surgeries that need to be done. It is going to have the wards to take care of the babies when they are admitted. And then we'll also have the outpatient services. So this is a good thing. And it's among the deliverables for our board, because we say that we're going to work on three things. First is the Mashinani project, which we already rolled out. Second is equipping the hospital and ensuring that it's properly staffed. We're already working in that particular section. And now our third project is ensuring that the child hospital is up and running. So that is a conversation we have started. The planning has started, and we are already working to get partners on board who can come and support us and ensure that that facility is actually up and running. Yes.
All right. There's a report that was put out where it showed that 50% of the babies born at Pumwani are preterm babies. Maybe why is there such a rise on preterm babies? I've seen there's a method actually you have embraced, that is the kangaroo mother care, which seems to be working. So why is the number so high when it comes to preterm babies? 50% is such a high number.
When it comes to the deliveries, we have 14,000 deliveries. Between 14,000 normal deliveries, we find that out of that, it's actually 30%, that would be preterm, not really preterm per se, but we have the different ages, and then you have the different birth weights. Now, you'll realize for that to happen, it goes back to your pregnancy period. And that is why that conversation we are saying for Mashinani is important. Why? Because the moment you conceive as a mother, how do you take care of your baby? How do you take care of your pregnancy? Are you feeding well? Are you looking at your nutritional issues? So that is why we are saying, come for clinic as early as possible. Because when you come, we keep weighing you to see, how are you growing? Is your growth as expected or not? So you're able to get medical care and attention and advice from the moment you conceive. But when they don't come, and they only come for delivery, that is where you find such incidents are arising. And that is why for us, we said, let us be proactive. We don't want to wait for you to come with a baby, it is preterm, then we take to NICU. No, 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 no. We want to talk to you before, so that we are able to curb the issue of having a preterm baby or an underweight baby. Okay? So that now we take care of these things as early as possible. And how are we doing it? Being at the mashinani level, talking to the community, telling community, demystifying, telling them we are safe, come. And ensuring that we are actually safe by ensuring that we are properly staffed, security is up and running, our nurses are up to, as required, are up to par, training is continuous, so that you are safe in terms of the personnel serving you, you are safe in terms of the equipment and facilities that we are giving you, and you also have as much care coming from the community as possible. So we are looking, once we have these three things happening, we know that very soon the numbers are going to go down. The underweight babies are going to, the numbers are going to go down. The preterm babies, the numbers are going to go down, because it's an all-inclusive kind of conversation. So right from the community to the facility, to the mother, to the spouse itself, and the family in which you are living in. Yes.
As I wind up with this conversation, I want us to touch on insurance. Does NHIF, now UHC, cover the entire delivery process? Or how is the payment being done?
We are actually very happy with what NHIF has been doing for Pumani Maternity Hospital. We've been having a conversation with the team within the sub-county level, and they've been very supportive. And what we are telling our mothers is, take your NHIF card, pay for those particular your premiums or your payout, your monthly payout, pay it. When you come, it will take care of you. It takes care of the normal delivery, it takes care of the C-section that has to be done. So we are encouraging as many people as possible, and especially the mothers, to take the NHIF and to pay faithfully, for that will take care of them.
The entire delivery
It takes care of the entire delivery. It takes care of CS, it takes care of normal delivery. So they are safe with the NHIF. So I am actually seeking everybody out there, you know that you are about to deliver, you have conceived, kama hujalipa NHIF, anza kulipa NHIF yako, so that it comes and takes care of you. Yes, so we are working very well with the NHIF team. We are happy with the services they are giving, and we want as many people as possible to have that particular cover.
All right, I will allow you to now give us your parting shot.
Thank you very much, Vivian, and the entire KBC team. What I would want to say at this particular point is that Pumani is a facility for you to come and deliver your baby safely. We are working very hard. The board, the management team, the county government, the governor, to ensure that we are giving you the services that you require, the services that will ensure that you are safe with your children, and you as a mother are safe, and the children are also safe. So it's a place to come. It is no longer the old Pumani that you used to hear. It is a new Pumani with a new team. Many things are coming, many things are happening. We are getting on the ground under Pumani Mashinani. We are going to very soon launch Pumani Babies. So we are looking out to all those people who were born in Pumani to come in and be part and parcel of changing Pumani, revamping Pumani, and ensuring that it is able to serve many other people into the future. We are also having the Pumani Child Hospital that is going to come up very soon. We are calling on partners to come on board, work with us, support us in ensuring that that becomes a reality, and we are able to serve as many people as possible. So we are, as a board, we are actually happy and excited to be able to be given the chance to serve. And we look forward to ensuring that we are able to give as much as we can to the public and to the community.
All right.
Yes.
Thank you so much for your time.
Thank you very much.
That was
Vivian.
Madam Evelyn, and she is a board member of the Pumani Maternity and Referral Hospital and the chair of the finance committee. And our topic was on the state of health, specifically at Pumani. This is where we call it a wrap right here on Good Morning Kenya. I have been your host, Vivian Ndegwa. Until next time, bye-bye.